Asalaamu calaykum waraxmatullaahi wabarakaatu. Anigoo ah Amino magacayga ah Amino Mohammed Abukar. Waxaan ka cabanayay muddo 10 sano jilba xanuun. Aan ka cabanayay oo wadanka Soomaaliya ka imid isbitaalada Soomaaliya dhan markaan tagay waxay dhaheen qaliin waaye. Qaliinkiina markaa waa isku aamini waaye. Waan ka cabsaday wadankan Hindiya imid Hyderabad isbitaalka Apollo waa lagu soo dhaweeyay macnaha Dr. K.J Reddy waa isoo dhaweeyay baaritaan oo igu sameeyay baaritaan kadib wadnahayga beerkayga wax dhan markaa la baari oo qaliin diyaar u ahay markaasoo qaliin igu sameeyay alxamdulillah isbuuc ka soo wareegatay isbuuc ka bacdi check up waa imid check upkii haddana isniina lay qali isniinteeda waa imid check up lagu sameeyay isniintii kala waay hadda maanta alxamdulillah lugihii waa la fiiriyay faashada waa la furay wax dhib leh oo hadda qaba male lugahayga caadi waay waa soconaa alxamdulillah daktarkaan aan u mahad celinaa K.J Reddy daktar fiican waaye alxamdulillah alshukru ana maanta farxad ma ii dhan alxamdulillah inay dadkan u imaadaan aad iyo aad u fiican yahay aniga hadda Soomaaliyan ka soo baxay saasaan intuu ku imid Hindi ku imid maasha Allah alxamdulillah lugahayga hadda caadiyan u soconaa farxad ma ii dhigna insha Allah khayraa rajaynaa insha Allah.
Hi, hello everyone. My name is Abdul Khadir Mohammed Ikar. I'm from Somalia. I brought all the way from Somalia to India. My mom, she's here. The patient of sitting here. She was complaining about knee pain and difficult of walking, especially long walking. So we have seen so many doctors back in Somalia, and after a thorough evaluation, they told us that both knees are severely arthritis and need a quick surgery. Then after that time, she was complaining this problem since the past 10 years. Since the past 10 years up to now, we were trying to find the best solution and where we can get that surgery. Alhamdulillah, after a couple consultation with so many people, we decided to come to India, especially Apollo Hospital. Even when we came to Apollo Hospital, it was very difficult to find a good doctor because there are so many doctors who is specialized in knees and all these things. So several people recommended us to see K.J Reddy, who is operating in Apollo Hospital. So we consulted with him, and he gave us a very good information, encouraged us to do this kind of surgery because my mom was very scared about this surgery. He gave us a very encouragement, and he has done a thorough evaluation regarding her heart, her kidney, everything, because she has a cholesterol, BP, blood pressure, and also thyroid. After evaluation of everything and multiple checkups, he recommended us to do the surgery because he has seen that the surgery is fit for her. And then we have done the surgery 2 weeks before. After the surgery, after 1 week of the surgery, my mom started to walk slowly. After another week, now the surgery is been 2 weeks, and now she's able to walk by her own. Now we came for checkup, the routine checkup. She has done the walking from the main gate of the hospital until here, and she's very happy for that. Finally, we are very thankful to Dr. K.J Reddy and his team for the warm welcoming and giving us the on-time information. So we thank him. Thank you so much.
Nowadays, knee replacement has become very common operation and a reasonably successful operation, provided it is done in appropriate patients in a perfect situation. And we're getting a lot of patients, international patients, mainly from Somalia, Nigeria, Middle East. Even American patients are coming because high insurance in America. And these African countries, especially in Somalia, what's happening is there's no facility to do a proper knee replacement. That's why they come to India and get operated here, and most of them are doing well. Like this lady, what happened is In India, the information to the patient is not given properly, because they go around, they do search on their own, roam around to see various doctors, then end up in one place. Like her, she has seen maybe more than 10 doctors before coming to me. We did a robotic knee replacement. Today is 2 weeks. And nowadays we are using sutureless scar. No clips, no sutures. They're all dissolvable with a glue. We use a glue so that it heals up nicely, and we don't have the pain of taking sutures out or clips out on 2 weeks. So this is a part of rapid recovery path, where we manage pain in very effective way so that they can stand and walk on the same day of operation, go home on a day 1 or day 2. As I said, she had a bilateral robotic knee replacement and she has done extremely well. You must see her pre-op x-rays and video. She had a severe deformity. Both knees were bent, and this is very appropriate to do robotic knee replacement, because we do a CT scan, know the deformity, and we feed into the robo. It will tell us how much to cut the bone, what kind of implant, and how to place it. Now she has become taller, she knows that, and knees are straight, and she will recover well. I must say, I think knee replacement, following knee replacement, recovery will continue. Probably it will continue to go up to a year, but most of the people will be back to normal activity in 3 to 4 months. So don't expect to recover completely in a couple of weeks. Otherwise you'll get disappointed, but it will take time, and some people take longer because of various conditions. So I think people like her would benefit with robotic knee replacement. So those who have knee problems must see an orthopedic surgeon, get the investigation done, and get appropriate surgery, which will be very useful, and it will change your quality of life, the way you look at your life.